Okay, this patient presented with a chief complaint of a sore throat. And this patient was seen by an outside doctor a few days earlier with the same complaint and was diagnosed with tonsillitis and given antibiotics. But the patient wasn't getting better, came into the ER and got scanned. So here's a axial cross-section CT of the face and neck with contrast. And if you scroll down to the level of the palatine tonsils, there is asymmetric fullness, with fullness in the left, kind of heterogeneous edema. I don't see any discrete fluid collection, but certainly, at the very least, edema or what we call phlegmonous change. So there is certainly involvement of the peritonsillar space. There are enlarged deep cervical lymph nodes. Notice the vessels here and here, sternocleidomastoid muscle, and then enhancing soft tissue that you don't see on the other side. So this is lymphadenopathy. But we see other lymph nodes nearby. So there is an infection going on. But notice right here, along the lingual surface of the posterior left hemimandible, there's a rim-enhancing fluid collection. So let's see what's going on at that same location on bone window. So at that same location, let me zoom in. What do we have? We've got a decayed tooth, periapical radiolucency, and marked cortical thinning and dehiscence of the cortical plate. And you can see that corresponds right to the same spot as this rim-enhancing subperiosteal fluid collection. So what we have here is a decayed third molar with periapical abscess, cortical dehiscence, subperiosteal abscess, and extension to involve the parapharyngeal and peritonsillar spaces. So I showed this case. I've seen this a number of times where an odontogenic infection, specifically of the posterior molars, is diagnosed as tonsillitis because there is infection and inflammation of the peritonsillar space. But you really don't want to overlook the possibility of a tooth infection. And this can be missed clinically very easily. The patient complains of a sore throat. You look in the mouth, there's swelling of the pharynx and of the tonsillar area. So it's reasonable. It also can be missed on CT imaging. I mean, you really have to pay attention to this area of the mandible. Notice that there's a subperiosteal collection here, and notice that it's associated with the decayed tooth. So again, I show this case not to suggest that this is what you'll commonly see when you see all this infection and inflammation of the peritonsillar space, but just as a cautionary tale to always look at the posterior mandibular molars when you see infection and inflammation in the peritonsillar space.